Diencephalon. When fetus is developing, cranial part of the neural tube gets three swelling: forebrain or prosencephalon, midbrain or mesencephalon, and hindbrain or rhombencephalon. The deeper part of the prosencephalon develops less, while the outer part develops more. Mesencephalon remains single entity. Rhombencephalon develops in pons, medulla, and cerebellum. The rest is the spinal cord. The outer swelling of prosencephalon is called telencephalon, which will make cerebral hemisphere, while inner two swellings, which are now close together, are called diencephalon. From spinal canal, fourth ventricle is where cerebellum is, then cerebral aqueduct in midbrain, and then an extended cavity called third ventricle. If we are standing in third ventricle, which is CSF filled, beneath us is midbrain. We have two dark gray matter on both sides called thalami. On the back we have central swelling called pineal body. On the back side of each thalami there is one habenular nucleus. Pineal body and both habenular nucleuses are called epithalamus. The fibers connecting both the nuclei are passing through the upper stalk of pineal body called habenular commissures. Superior colliculi and inferior colliculi are the part of mesencephalon. They are located on the both sides of the cerebral aqueduct. Above these there are two pretactile nuclei present, and fiber going to and from are called posterior commissures. They are passing through the lower stalk of the pineal body. Both thalami are touching each other with a small gray part called interthalamic adhene. Anterior commissures are between two temporal lobes. They are part of telencephalon. If we start moving forward, midbrain will terminate while third ventricle will keep moving forward above us. Now we are standing in hypothalamus. The walls are also called hypothalamus. There is a central swelling, then tuber cinereum, then median eminence, which is another swelling, and then pituitary stalk, and then anterior and posterior pituitary. Mammillary bodies are hanging. There are two swellings in the back and lower side of the hypothalamus. The weight of the hypothalamus is only 4 grams. On each thalami there are geniculate bodies. Each thalami is sitting on the midbrain called subthalami. Now from each thalami's lateral geniculate body, then optic tract, then optic chiasma, and then optic nerve. Hypothalamic sulci is where thalami meet hypothalamus. Interventricular foramens are two apertures right ahead of hypothalamic sulcus. Anterior pituitary is not a part of diencephalon. Only posterior pituitary is a part of diencephalon.